Proper hand hygiene is the single most effective way to prevent transmission of microorganisms, reduce the incidence of infection, and promote the health and safety of staff, patients, and visitors. Hand hygiene is a shared responsibility, so encourage and remind one another to perform proper hand hygiene routinely. Hand hygiene is necessary in the following circumstances: before coming into contact with a patient or entering a patient's environment, prior to accessing gloves or putting on personal protective equipment, before a clean or aseptic procedure such as wound care, and handling intravenous devices, or prior to handling medications or handling food. Perform hand hygiene immediately after exposure or risk of exposure to blood and/or bodily fluids, following the removal of gloves, and when removing personal protective equipment, when your hands look or feel soiled, after you've been handling patient care equipment, after contact with and before leaving a patient or their environment. If you are wearing a cast, a dressing, splint, or have a skin condition that interferes with proper hand hygiene, you must not perform direct patient care or perform other tasks that require hand hygiene, including activities like reprocessing or handling of surgical linens, handling medical devices, preparing pharmaceutical medications, or preparing food for others. If you are unable to perform proper hand hygiene, speak with your supervisor about modifications to your work. There are two ways to perform hand hygiene. They include hand washing with soap and water and use of an alcohol-based hand rub. Antimicrobial soaps should not be used for routine hand hygiene. They are intended for use only in limited instances and locations. The use of soap and water is necessary to clean your hands when they look or feel soiled. It is also required when caring for patients with diarrhea and/or vomiting and during food preparation. Soap cleanses the skin of potentially transmissible microorganisms by lifting them off the skin. Here's how to do it properly. Firstly, sinks that are used for hand washing must be dedicated to hand hygiene and cannot be used for equipment cleaning or the disposal of blood, body fluids, or waste or food preparation. Remember, you must not wear artificial nails, nail enhancements including gel and acrylic nails, or have chipped nail polish. You must not wear wrist jewelry or rings with crevices or stones if you are providing direct patient care or performing tasks that require hand hygiene. Start by wetting your hands under warm running water. Avoid the use of hot or cold water because it's hard on your skin. Take care that your hands do not get contaminated by touching the sink or the taps while you are washing. Dispense the soap into your hands. You'll need enough soap to produce a good lather, usually 2 pumps is good, an amount roughly the size of a loonie. Lather up thoroughly. Rubbing hands together when you wash helps to remove skin cells that may contain organisms and break up soil. A proper hand wash takes at least 15 seconds. Be sure to rub between your fingers, under your nails, and around cuticles. Do not forget to scrub the backs and sides of hands, as well as thumbs and wrists. Rinse under warm running water. Rinse your hands well until all the soap comes off. Point your hands down as you rinse to avoid splashing on your wrists and forearms. Next, dry your hands with a clean, disposable or single-use towel. Blot your hands gently with the towel so as not to damage your skin. If you're using a sink with taps, use the paper towel to turn the taps off to avoid contaminating your clean hands. You can also use the paper towel to open the door if one is present. And dispose of the paper towel in the garbage. Your hands are now ready to provide safe care.